Is Dr. Elizabeth Onyango. I work with the Ministry of Health in the Division of Non-Communicable Diseases. In Swahili we say idara ya magonjwa yasiyo ambukiza. So today we are marking the World Sickle Cell Day. This day is very important for us, like other World Health Days. It's an opportunity, it's a day where we take advantage and create awareness on this condition. This year, we have chosen to have it commemorated in Kisii County. Kisii County is one of the high-burden counties in the country for this condition. We've mentioned we have the western region and the coastal region. But the way people migrate, the way people intermarry, we are finding that more and more sickle cell disease are being identified in other regions as well. So for us at the ministry, it is important that we enhance policies, we come up with policies that enhance early screening for the condition, early diagnosis, early treatment, and to avoid complications. We know that children and every other person has a right to access the highest possible quality of care. And quality of care, not necessarily health care, but we want the children to be able to achieve and realize their potential, be able to go to school without worrying about this condition. And so that is why we are committed that we will ensure that we have policies in place that will advance access to these services. How are we doing it? We have partnered with a number of organizations. We have the Kenya Hemophilia Association, we have the Kenya Sickle Cell Federation, we have the NCD Alliance, which is very good in advocacy and education, campaign and awareness. And we also have the counties, because service delivery is done at the counties. We want to ensure that we build and also partner and a number of organizations that I will not have mentioned. We want to ensure that healthcare providers, wale ambao wanapea huduma katika vituo vyetu vya afya, they are well trained, they are educated enough, so that they have the skills to be able to provide services concerning sickle cell. They are able to screen, they are able to identify these children early, and they are able to identify any person with sickle cell early and put on treatment and refer where possible. We have the premarital counseling, where we want to ensure that couples who are carriers may make decisions and know what they are getting into, but the ultimate goal is to reduce the number of children who are born with sickle cell.
On the government of Kisii, we want to assure all those that are suffering from this disease that as a county government and the Department of Health, we are equal to the task. We have specialists trained specifically to handle this disease across our facilities in the county, and therefore we are asking those who are fighting this disease to reach out to our specialists in our facilities so that they can be treated. We have equipment, we have drugs that are necessary in fighting this particular disease. Kwa hivyo wananchi wote wa Kisii tunawasihi msiweke wagonjwa kama nyumba zenu. Tafadhali muende kwa hizo vituo vyetu vya afya muweze kuhudumiwa mapema, kwa sababu sisi tunasema kwamba mapema ni best. Ugonjwa ukijulikana mapema bila shaka utatibiwa. Kwa hivyo tunawasihi mfanye vile nimesema, muitikie wito wetu, ufike pale, madaktari wetu wako under instructions kuhakikisha kwamba wagonjwa wa aina yoyote isipokuwa hata kama ni ugonjwa wowote wahudumie watu wetu waweze kupona. We have the commitment as a county government of Kisii. We have that will, and we want to assure you, members of public and the Kisii County fraternity, that we are equal to the task and we are ready to work with you very closely in the fight against any disease that is afflicting our people in the county. They can always get better if they are ready and willing to fight this menace.
Advocacy relations consultant with AMPATH, the academic model providing access to health. So AMPATH is also a collaborating partner with the Ministry of Health and NCDAC, which is the Non-Communicable Disease Alliance of Kenya, and with the Memorandum of Understanding, which was launched around a year ago, which is called the Afya Dhabiti. We are also relaunching it today to year mark the work that we have done. At the end of the day, yes, finances is a little bit of a concern, but partners are willing to continue supporting, and we ensure that sustainability in terms of access to medicines and services is one of the key components to ensure that patients living with sickle cell receive the appropriate care.
The county head of non-communicable diseases, among them sickle cell disease, and this is World Sickle Cell Day, which is commemorated by the national government at Kisii Polytechnic. This is an opportunity for us to showcase or to increase advocacy among the community and the world. Currently, the burden is increasing in Kisii County. As at now, we have about 295 people living with sickle cell disease in our clinic situated at Kisii Teaching and Referral Hospital. And as NCDAC has talked about a project called Sickle Cell Afya Dhabiti project, which has also brought that component in Kisii County. The past 2 months, we've done a number of screening of under 1 year olds, that is infants, and our positivity rate is increasing, and that is giving us a wake-up call. 14% of the patients who are screened were noted to have sickle cell trait, and 4% had sickle cell disease. Having that in mind, this gives us an opportunity to have a discussion with the community for early screening and discuss with the government. As a government, the good thing is there is a buy-in to increase management of sickle cell, improve on it in terms of drugs and diagnostics. So after the screening is done, we are able to do confirmatory tests still at Kisii Teaching and Referral Hospital. We welcome the community to increase awareness and know their situation so that we can reduce the numbers.
Sickle cell disease will be advocating for to the government in terms of one, diagnosis, in terms of access to treatment, access in terms of availability, access in terms of quality of treatment, access in terms of the cost of the treatment at a place that they can actually access in terms of geographical access. So you need to be able to access treatment and care at a cost that, one, is accessible to you and it's also affordable to your family. And really, if you do have these conditions, they should not compromise your education, they should not compromise your opportunity to live to adulthood and to actually contribute to nation building.